I want to welcome our guest, Ritika Goel. Dr. Goel is a family physician and an assistant professor at the University of Toronto, and she spent years doing organizing and advocacy at the intersection of health and social justice. She's worked with Canadian Doctors for Medicare, the Decent Work and Health Network, and Doctors for Defunding the Police. Ritika has been closely following the impact of pandemic policies on marginalized communities, and she recently co-authored a piece on the state of Medicare in Canada. Ritika, welcome to the program.
Thanks for having me.
Hi.
Hi.
You're our first panelist.
Yeah, yes, a first for the
Definitely
show.
exciting.
We've already forgotten about Martin.
Yeah, when he's Martin.
That's mean.
So we're more than 2 years into this pandemic now, in the midst of a sixth wave, and reports are suggesting that by now almost half of all Canadians may have been infected with COVID at one point or another. Hospitals are still at breaking point. Healthcare workers are suffering from widespread burnout. And yet, our governments are scrapping public health measures, reopening businesses, lifting vaccine mandates in almost every province, and getting rid of vaccine passports. It's really hard not to feel like we're all being abandoned and left to fend for ourselves, especially people who are most at risk. Ritika, I want to start with you. I mean, how did we get to this point where our governments have decided that we're basically all going to just, quote unquote, live with COVID?
Yeah, I think what we've seen over the past 2 years is over and over governments and politicians treating what is a pandemic and what is in many ways an illustration of what happens when we don't approach policies with social solidarity in mind. We see the outcomes that we're seeing exactly in this pandemic. In a way, we're seeing exactly what people in the housing system, in the shelter system, in the prison system, in the healthcare system have been saying would happen because the systems have been at a breaking point for so long. Before COVID hit, the healthcare system was operating at near 100% capacity. We never really had surge capacity built into the system. We had people that couldn't access affordable housing. The shelter system and the prison system had people living in deplorable conditions, migrant workers living in deplorable conditions, Indigenous communities with huge overcrowding. And so we've seen really exactly the people who've been most marginalized by these systems, by these governments, be most disproportionately impacted. They're the ones who've gotten sickest. They're the ones who have suffered the most, and that's what continues to happen today.
And so much of how the government has handled the pandemic has been about emphasizing, individual actions like wash your hands, socially distance, wear a mask, stay at home, get vaccinated. How far has that approach gotten us?
Not too far. I think even that is problematic in terms of who's able to follow these instructions. So if we look all the way back to March 2020, when the primary way people were being told to deal with the issue before the vaccine was just to distance, distancing is not something that's available to people that are living in overcrowded situations. It's not available if you're living in a shelter. It's not available for new immigrant families that have, by definition, to live in overcrowded situations. And when we talk about masking, who's able to afford the masks that we know are most effective, like KN95s and N95s, who's left wearing the cloth masks? There's never been really a conversation, even with those individual measures, about who has access to what parts of those. And something similar with the vaccine. Have we invested funds into ensuring that communities that understandably do not trust the healthcare system can actually get good information? Have we given our public health system enough funding? Here in Ontario, before COVID, Doug Ford had slashed the public health system, and we never really recovered from that. So those are even the individual measures, which are problematic on their own. But of course, we haven't seen what we really need, which is the broad public policy approaches that actually explain why people get sick. So it doesn't matter how much you distance, how much you mask, how much you wash your hands if you're working in a crowded manufacturing plant. It doesn't matter if you're forced to go to work at a migrant farm where at baseline we know that labor laws were not being followed, and we know that people were facing medical repatriation. And it doesn't matter if you're living in the shelter system and you're not able to access the supports that you need to access. So we need the government to be using, our resources. These are our collective resources, and they should be using them to change public policy, to bring in paid sick days so people can actually go home and be with their families. There was research done that showed that people were choosing were choosing to come in sick because they really didn't have any option not to, done by Peel Public Health, looking at many of the factories in the Greater Toronto area where we know there were outbreaks. People chose to go in when they had symptoms. People even chose to go in sometimes knowing that they had tested positive because they had no other choice. Mm-hmm. And so time and again, we have called for paid sick days. We've called for decent wages. We've called for actual accessible housing and proper funding to the healthcare system. But that's not what's being put in place.
Yeah, and rather than just approaching the pandemic with healthcare policies. It's pretty clear that we need social policies. And you mentioned the fact that social distancing and a lot of these other precautions were really impossible to do for a lot of different communities. And Elle, I wanted to ask you, when the pandemic first started, places like prisons and shelters were basically petri dishes for the spread of infection because of how overcrowded they are and how vulnerable the populations inside already are. As someone who's been involved with organizing with prisoners, you made the case very early on for decarceration, the release of prisoners as an appropriate pandemic response. Can you talk a little bit about that and how the criminal justice system has handled COVID?
Yeah, so provincially, Nova Scotia is actually a so-called leader in this area in that we let 41% of people go during the first wave of the pandemic from provincial prisons, but we didn't see anything federally. I don't even know if half a dozen people ended up released federally. There was no mass releasing at all. And one of the things that's frustrating at this point is, people were told if they got vaccinated, because a lot of people obviously are in prison, like the same nursing staff that's, disciplining you for like cheeking your drugs, or you're being stripped naked after you go to get methadone. Now those same people are telling you, well, you trust us, we're going to vaccinate you. So obviously there's a lot of distrust, and you have a lot of Indigenous and Black communities in prison that have cultural and historical reasons to mistrust. And they were told that if you guys get vaccinated, then maybe you can resume programs, you can do visits, you can do these things. So a lot of people got vaccinated. And what we're seeing right now happening is frustrating because provincially, for example, they've reintroduced double bunking. So it's okay to be in the cell with somebody else because I guess COVID is over. But then federally, every time there's a case, their visits are cut. People were supposed to have, be able to go out to halfway houses and stuff. And the way that they're managing it in our halfway houses in prisons right now is if somebody gets COVID, they just shut the range down or the house down, but it just passes from person to person, and they wait till the last person is infected and then quarantine for 2 more weeks. So this can go on forever because you have one person, then 5 days later somebody else gets sick, then 3 days later somebody else gets sick, and it's just going on and on and on. So federally, right now there's 40 cases in Dorchester apparently, which is a minimum security prison, and people have been waiting years to get out to just get into the community visits, have had those cut, and they don't know when that's coming back. All the education programs, lawyer visits, counseling, AA, all of that has been cut forever, and it was just coming back, and now it's cut again. But then, at the same time, they're also saying things like, oh, it's safe to be in the cell with somebody. It's it's so interesting that what it seems to be saying, of course, is you can go catch COVID in the prison. We don't care about you, but we don't want you bringing it out. So we have this extra caution that's way beyond what the health regulations actually are on quarantining if you're moving from a halfway house or if you're moving from a prison. But when you're in the prison, we're not going to protect you. So even though they say that there's PPE and there's all these things, the air vents go through the cells in provincial prison. People have been trying to stop up the air vents. They're quarantined on the same ranges as people with COVID. They're using the same phones. It's not properly cleaned by any means. So yeah, it's just been a discarded population, and at the same time, a lot of coercion around getting people to follow health measures on promises, and then, as usual, not following through on those promises. So a lot of people, it's made even more skeptical of the healthcare system, and I think that's ultimately so damaging because people get out of prison or jail and they don't want to engage with the doctor. They don't want to go get counseling. They don't want to do things that actually help them be well because they've experienced those in so many abusive ways.
Pam, with the sixth wave of the pandemic, COVID is obviously on the rise everywhere, but including in Indigenous communities. And last week, Patty Hajdu, the Federal Minister of Indigenous Services, had this to say about that.
We know that COVID-19 is still having a very significant impact on First Nations communities at this particular time, and I want to assure communities that Indigenous Services remains ready to help whenever and however we can. Our officials in Ottawa are working with many communities as we speak, and our regional offices are there just a phone call away if anything is needed, and there still remains funding available through the Indigenous Community Support Fund in our efforts to protect each other.
That was Federal Minister of Indigenous Services, Patty Hajdu. And Pam, given that healthcare and other infrastructure in Indigenous communities have been historically chronically underfunded, how has the pandemic played out in these communities?
Well, if you think about it, like all of the outbreaks, epidemics, and pandemics throughout history have always disproportionately hit First Nations very hard for all of those reasons, the reasons of colonization, being forced to live on reserve. You can't live on country food anymore. You're living on rations, lard and flour and sugar. That's not going to make you very healthy for very long. So you've got multiple generations of being denied the ability to provide, for your own food, all of these rates of poverty, overcrowded housing, lack of clean water, lack of running water in some communities, lack of sanitation, all of these things, and then lack of access to appropriate health care on reserve or near the reserve. And then for those that have to go off reserve or who live off reserve, to be denied health care services at hospitals and clinics because of racisms and stereotypes, because there's an assumption that you're just drug seeking or that you're faking it, or like all of these kinds of stereotypes that we've found that they do against First Nations. So they get it on all fronts. And I mean, think about what happened with, H1N1 when First Nations were asking for help and they were being sent body bags, for example. They were disproportionately impacted. Now here with COVID-19, very, very early on, First Nations leaders all over the country and Native American leaders from the tribes in the U.S. were reaching out to governments saying, we see this is coming, we want to prepare, we want to stock up, we want to have emergency measures in place. And the federal government was just slow on the draw. I mean, the United Nations was already making statements well ahead of the federal government saying, listen, states and countries around the world, you need to address this crisis of COVID because it's going to hit Indigenous peoples worse and harder because of all of the history of colonization and the enforced poverty and the marginalization and all of the ways in which, as we've already discussed, where Indigenous peoples are. They're, disproportionately institutionalized in prisons, in youth corrections, in shelters, in hospitals and mental hospitals, and like a whole bunch of other places where it's not safe and it's certainly not clean. Anyone who's ever gone to a prison knows it's not just the overcrowding. It's like so unsanitary in many of the prisons and jails. So it's disproportionately impacting them. And it's interesting to listen to her say, we're just a phone call away. If only that was the case. And in fact, some of our treaties actually say that whenever there's a famine or sickness, just call the Queen and we will be right there. Well, Canada acts on the Queen's behalf right now, and they're not there.
And I think a big theme emerging from what all three of you are saying is that, the pandemic didn't emerge in Canada in a vacuum. Obviously, there have been generations of Black, Indigenous, and racialized communities in Canada who whose experience of the healthcare system has been marred by racism and neglect. And you've all talked about that lack of trust in the healthcare system that's existed. And I guess, Ritika, I wanted to ask you what you think of how well the government directives around the pandemic acknowledged and addressed these legacies and that lack of trust.
I don't think they do. I think, when you make something like a vaccine available and you've underfunded the public health system and therefore there isn't really appropriate communication that's going out. And in fact, I would argue in many ways, the media has played a role to, really terrify people when it comes to the vaccines. And, I would hear this every day as a primary care provider when people trust you and they ask your opinion. The amount of misinformation that people had from the media was just astounding. And they were terrified. And there were all sorts of reasons for that. But I definitely, in my clinic, in the populations that I work with, I saw the disproportionate number of folks who were Black and Indigenous. They were the people who were least likely to trust the vaccine. And sometimes, I was able to convince people based on the relationship that I have with them, but oftentimes I couldn't. And that's not a coincidence. So I see even the efforts that have been put in place to create community-specific services. Those have been efforts that have been led by the community. I haven't seen that be something that the government has acknowledged at any level to be a priority and require extra funding or extra work. I think about how when the vaccines were released, when it was the first dose, then the second dose, and the third dose, we learned no lessons. And every time it was the same people that were the most privileged, the ones who had most access to education and health literacy, tech literacy, that were able to access those vaccines, and everybody else fell behind. So, I didn't see really an equity-based approach at all. There wasn't a good acknowledgement of that.
And you've called this, and I know others have coined this term too, but a kind of vaccine Hunger Games.
Yeah, that's absolutely what it felt like, where people were just kind of figuring out however they could get access. And I can't blame somebody who's got more access to information and who feels more comfortable trusting healthcare for advocating for their family and trying to go ahead and get something that they trust. But that's why we have to have an equity-oriented approach. We have to start by really only allowing access for those who we know need it most first, or we have to make things accessible by providing locations that are most convenient for the people who most need it first, just to mitigate and to kind of know how people will react and respond, and how do we make sure that people who are working, for example, 9 to 5, how are they able to access things? What do we do with pop-up clinics that really only would announce that they were available a day or two before? How are people who are working, who have to arrange childcare, supposed to manage things like that? So there were many ways in which even we could see that we didn't learn any lessons as the waves continued, as the vaccines appeared, 1, 2, 3, and now 4. So it's been really disheartening to see that, and I guess in many ways not really surprising.